Dr. Osborne here with a 2017 New Year's health resolution. So many of you are getting ready to set your goals for the new year. You're getting ready to lose weight or set your goal for weight loss or pain reduction or exercise more. You're getting ready to conquer maybe a particular kind of condition or disease. And so you're setting your goals up for the new year and your resolution to win these battles. And as you're setting these goals, I want you to think, and I want you to think hard on how you're setting those goals. You see, the average person in this country is going to die from heart disease, cancer, autoimmune disease, diabetes, or obesity-related disease. The average person in this country over the age of 35 is on 5 or more medications. The average person in this country is going to go bankrupt because of their medical bills. You don't want to set your sights on average. You want to set your sights above average. And I say that because so many of you are getting ready to change your diet. Maybe you're thinking about going gluten-free or sugar-free or dairy-free. Maybe you're thinking about going on a true gluten-free diet or a paleo diet. Maybe that's part of your resolution. As you're making that goal, the people around you who are normal, who maybe are setting the same goals but don't understand the importance of diet change, lifestyle change, maybe they're making fun of you. Maybe they're calling you a quack. Maybe they're calling you crazy. Maybe they're trying to call you a health nut. Maybe they're trying to tempt you into breaking your New Year's resolutions because their sights are set on mediocrity and their sights are set on normal. And so you have to rise above that. You have to rise above those people who are striving for normal, because normal sucks. Let's take a look at what it means to be normal. The average normal person will be obese or overweight. 66% of the American population falls in that category. The average American has drug dependency, whether it's caffeine. Yes, caffeine is a drug. Whether it's some other type of drug that's prescription or over the counter, like allergy medicines or heartburn medication. Whether it's a drug that is there to control high blood pressure or some form of blood sugar issue, or whether it's a drug that helps suppress depression. Those are dependencies. Those are needs that develop as a result of poor choice and behavior, and that's what normal is. Those people have chronic diseases. Those people have heart disease and diabetes and pre-existing cancers, or they have different types of heart conditions like high cholesterol or like high blood pressure. The average normal person is going to have a medical bankruptcy. It's the #1 cause of bankruptcy in the United States is medical bills. So when these normal people are trying to tell you how crazy you are, they're trying to tell you that you are a health nut, you have to remember these things. Being normal is not what you want to be. Let's just look at a simple example. The average person in the United States with high cholesterol gets prescribed a statin medication, right? So looking at this diagram, the doctor gives a statin drug. What's the consequence of that? This drug suppresses energy production by the cells, by the mitochondria. So it creates a scenario of low energy. The drugs also are known to cause muscle loss and muscle atrophy. If you're on them for long periods of time, that leads to pain. It leads to exercise intolerance. Well, what happens when we can't exercise because we hurt? That leads to sedentary lifestyle, which feeds right into obesity, feeds right into weight gain, feeds right into more muscle loss. And we couple that with the average normal diet, which is biologically inappropriate. It's full of sugar. It's full of processed food with genetically modified ingredients. The average normal person doesn't even read a food label. The average normal person doesn't question where their food comes from. They don't have enough pride or enough self-respect to challenge where food is coming from. And so they look at you when you do make that challenge and they call you crazy. You don't want to be normal. Being on that statin causes muscle loss, muscle weakness, fatigue, weight gain. Over time, all of those things that the very drug that we are taking that was designed to inhibit heart disease is actually feeding into heart disease. That's why it's the statin paradox. That's just one example. I could literally go through hundreds of examples of other drug paradoxes. We don't want to be normal because we get stuck in that normal rut where we're on drug dependency, where we're dealing with chronic disease, where we're dealing with obesity and weight gain. That's normal. So when you're making your resolutions and you're trying to find your own internal fire to keep you going, you're trying to find what will push you, what will drive you, what will keep you going, so that all those people who are normal trying to bring you down don't. Just keep in mind, normal sucks. You have to become a warrior. You have to be your own advocate. So when you're making out your New Year's resolution and you're sticking to it, and 3 weeks in or 4 weeks or 6 weeks in, some of the people around you who are normal are telling you how crazy you are because you have self-respect and care enough about yourself to make meaningful changes. You can look at them and you can say, look, I don't want to be normal. I don't want to eat normal food, and I don't want to eat a normal diet because normal sucks. I'm a warrior because I care about me, because I have self-respect. So remember this message as you're trying to stick to that New Year's resolution. Remember, a resolution without fortitude and without consistency and without application will get you nowhere but Normalville. This is Dr. Osborne. I wish you a very Merry New Year, and we'll talk to you in the next Web Wellness University update.